Hi, and welcome to The Girls. I'm your host, Deb Lassant, with my co-host, Janine Lassant. And we are coming to you from our homes, the comfort of our homes, into your home, wherever you're watching us on any of your devices. We're using some COVID restrictions, and we are feeling okay, but I guess there's always a chance, right, Janine?
Well, I hope not too much of a chance. I guess that's the debate. But I'm one of the vaxxers. I'm vaccinated.
So am I. I'm vaccinated.
But there's all kinds of rules going on. So we're home. We figure we'll play it safe. And we like to say that in every show, because if you're watching this, maybe with fingers crossed, later when these rebroadcast in 2022, hopefully you'll be, watching a rebroadcast of the show, and we will be back live and in person.
Yeah, we'll just be talking about a thing of the past like we did years and years and years ago when they got rid of other pandemics. But talking about years and years ago, I was looking through some pictures, and I don't know, Janine, if you're going to remember this picture, but I remember it vividly. You were about 10 years old. So it was only about 10 years ago.
Right.
About 10 years old. And for me, I remember that selfies started with the cell phones, and then with having a camera on your phone.
Okay.
And before you know it, people were just like trying to turn their phones around and take their pictures. Now, of course, there's all the devices and ways you can do it easier, but I think you invented the selfie, because I'm going to show this picture right here. Can you see it? I don't know if I'm tilting down enough. This is you taking a picture of yourself. And this is when the film had to be developed.
That's funny.
Just look at yourself. It's just like, wowies. Janine invented the selfies.
Okay, do I look the same?
Well, yeah, the same. Yeah, it's pretty much the same.
So it's funny that you mentioned that with the cameras, because I was explaining to the kids, or I shouldn't say I was explaining to them. It was Alyssa's birthday, and she had, someone had bought her a camera, like a Fuji camera, where she's like, you actually take the pictures and then you have to go, and Mom, you have to get them developed. And I said, no way. I said, when I took that picture of myself, it was more of a joke for the people, because when you went to get the film developed, the person developing the film would see the pictures. So
of course, they looked at all your pictures
around and being like, hey, see if they see me in this picture. But we didn't get the instant gratification. If you looked okay in a picture, you took the picture. If your eyes were closed, guess what? Tough poopies, kids, because you didn't find out in a week or 2 weeks later, right? Until you picked up.
If you were lucky, there's an episode on TV of, I think it's The King of Queens, where they go to the store and they pick up their photos that they think are theirs. They get home and they find out they're not theirs. So they're enjoying all these photos from someone else's vacation. It was just funny how you said everybody looks at them. And when they went back, it's like the people who worked there knew what they were talking about. They go, yeah, how about the guy? And they were doing this and they were doing that. So yeah, it was pretty much an invasion of your privacy too.
And now it's like, you don't even, I don't remember the last time I really had film developed, and even these kids, they don't have a lot of their pictures printed out. They just keep them on their phone. So everything's digital.
I love hearing you say these kids today.
These kids today.
You're my kid. And it's just so funny, because a lot of times you'll say things to me and I'll go, I know. Or
even like these college visits.
I went through it.
When I was growing up, it was like you looked at one or two colleges maybe, but you kind of knew you were going to a certain college. And now, it's a process. It's a year or two process where they're visiting campuses. Then they meet with, the school counselor, administrators. It's a day. It's a day.
Is that all?
It's a day. For one school, it's a day.
Yeah, for one school, it's a day.
Process of going through it. So it's fun how stuff has changed. It's exciting too, because Alyssa and I have been going to different schools, and it's nice to visit different campuses. Of course, we stopped at King's College, my alma mater, and we went.
It's brother's alma mater.
Yes. So no pressure, kids going. Our kids going to school, but they looked at King's, and a lot of different schools in Pennsylvania. So we'll see what happens, but
So we're sticking with
so many
PA.
times have changed, right?
We're sticking with PA, and I don't think any of them are declared yet as to what exactly they think they're going to be. There's so many choices now, so many opportunities, so many different avenues of interest, and they just are, they're into everything. So you don't know what they're going to end up being. It's strange for me to sit here talking about my grandchildren going to college because
And they're going where they're not sticking to PA as much as they're going where they get the most financial aid. So I think that's big now, where they can decide where they get the most money and then make that decision. But again, I'm sure parents at home are going, and they understand, because when you meet parents who went through the process or just went through the process of the new ways of application and everything online, it's a lot.
Well, I knew a girl, in fact, when I had my gift shop, she worked for me part-time because she had come back home from college and she had received a full scholarship, full scholarship for 4 years to a local college. And of course, her boyfriend wasn't going to that college. So she decided to go to the college her boyfriend went to. And then after 6 months, they broke up. Now she wanted to come back home because she couldn't stand seeing him every day. And so she ended up going to the college that she originally got the scholarship, but here she had no money. She had to pay for it.
Yeah.
But, I mean, that was I think you had a girlfriend that did that as well. But
that's tough.
Yeah, that's tough. I think the parents were probably having a difficult time more than
Let's hope that stuff doesn't happen, but we'll see. But we want to remind our viewers that October, again, is Breast Cancer Awareness Month. All month of October on the girls, we have been focusing on cancer awareness, all different forms of cancer, having cancer survivors on. Their stories have been compelling. And we wanted to thank specifically the Lehigh Valley Hospital Network, because they have been sponsoring all of these shows. Again, with local programming, we need some local advertisers that make this show happen. And they are a really big supporter of SSP TV. We have Lehigh Valley Health Network on with us today. We have doctors, how important it is to talk with the doctors about cancer awareness. So we have them on with us coming up. We have Dr. Michael Evans. We have Dr. William Harder on the program. So again, the focus of these shows for the month of October is cancer awareness. So we will be right back. And we will see you when we come right back here on The Girls on SSP TV.
Welcome back to The Girls. Today, I'm very excited and very honored and pleased to have two guests on our show, both doctors. And the first doctor we're going to speak with is Dr. Evans, and Dr. Evans is a huge part of the Lehigh Valley Health Network. At one time, everyone that knew Dr. Evans from past experience with cancer diagnoses knew him in the hematology department. And now, Doctor, I understand that you're involved in all departments and facets of oncology with the Lehigh Valley in most locations. So welcome to the show. Thank you for taking time out of what I'm sure is a most busy schedule, because I don't know about you, but I know so many people who are being treated for cancer right now. And in a way, that's great, because I remember in the day when you heard the word cancer, it was like a death sentence. And now you have so many treatments and so many cures, and we're seeing much more survival rates. So catch us up to date on everything about the treatments and the survival that you're seeing as well.
Okay, great. Well, thank you for having me on today. It's very true. You know, people are doing much better with cancer. In oncology, we consider something called overall survival, and so that's how long people live after they've been diagnosed with cancer. And you know, obviously that can be anything from a very short time to a very long time. And the stage at diagnosis is very important. If somebody is diagnosed earlier, then you know, the treatment options are generally better. There's a greater chance of a cure, and so the overall survival for that group of people goes up a lot. And that's really one of the areas that's improved a lot. Is we've gotten better at screening. We catch more cancer when it's early, and so there's better outcomes for that reason. Another reason is because we have so many more treatment options than we did just a decade or two ago. It used to be that all we had was chemotherapy, which is not very specific. It doesn't just kill cancer cells; it kills any cells that are actively dividing. So since cancer cells are always dividing, which is what makes them cancer, it's effective against cancer, but there's also a lot of side effects, and it's not very specific. Now we have immunotherapy. We also have what we call molecular targeted therapy. And so we have many more options. And so having more options, better options than chemotherapy a lot of the time, also results in better overall survival, regardless of whether it's early stage or later stage. And the third thing that we're doing a lot better is we are picking the right treatments for people better. So we've come to realize that not all cancer is the same. Obviously breast cancer is different from colon cancer and lung cancer, but we're coming to realize that within specific cancer types, one type of lung cancer might have one specific gene that is mutated that's driving the cancer. And now with all of our new targeted treatment options, we're able to match the right treatment to the right gene abnormality that caused the cancer in the first place. So, we're doing better at screening. We have more options, and we're picking who gets what type of treatment a lot better, and it's resulting in better outcomes across the board.
Dr. Evans, again, thanks for being on the show. My mom and I have been talking about cancer awareness all month in October. And you brought up a good point of early detection with certain cancers or any cancers. What other types of cancers or what kind of cancers have you seen most prevalent maybe in a specific area where we tape the show? And that would be the Greater Hazleton, Lehigh Valley Health Network areas.
Of lung cancer, smoking-related of colon cancer. And so those are two areas I think everybody's known for a long time that we can screen for colon cancer with a colonoscopy. And so, always advocating for people to get their colonoscopies done to catch cancer early. For lung cancer, it's a little bit newer. We can actually screen for lung cancer in anybody over the age of 50, between 50 and 80, if they've got a significant smoking history and either currently smoke or quit within the last 15 years. We do an annual low-dose CAT scan to screen for lung cancer. And one other cancer I wanted to bring up was head and neck cancer, because we do see an increase in that lately. And that's one where we don't necessarily have screening for, but we're seeing a change in the type of head and neck cancer. It used to always be that head and neck cancer was associated with a smoking history and a heavy drinking history. We're seeing more and more now that it's actually associated with a virus called HPV. And the HPV virus is interesting when it comes to cancer, because instead of being able to screen, we can actually prevent it with an HPV vaccine that has been available for a few years now. And it's recommended to start vaccinating children between the age of 11 and 12 and young adults up until the age of 26. So it's more than just screening. We have great screening for breast cancer, obviously, with the mammograms that everybody's so familiar with, colonoscopies, CT scans for lung cancer, but prevention with HPV vaccination.
So, doctor, if someone is going to have their yearly physicals, I guess age would make a difference, but what are the 3 or 4 main things that they should be screening for every year to making sure that they're on top of their health? What does that consist of now that there's so many concerns with all these different forms of cancer?
Well, from a cancer standpoint, for women, breast cancer screening with the mammogram should be done annually, ideally starting at age 40. For men and women, screening for colon cancer should start at age 45. There's some leeway there because different societies have different age recommendations.
So for men with cancer screening, doc, which one is the one that is the most prevalent right now? Is prostate cancer something that everyone should be getting screened for after age, 40?
Well, prostate cancer, it is very common. It's the most common cancer for men, but the screening is a little bit challenging. It's not as easy as, or not as straightforward as breast cancer. So not all prostate cancer is created equally. A lot of prostate cancer is very indolent, meaning it's not growing very quickly. And so we can screen with a blood test called a PSA. which is very sensitive. If the PSA level goes up, it's usually cancer, but it can also be some other problems in the prostate. The issue is that once you have a elevated PSA, you feel obligated to pursue a biopsy and the whole workup, when it in most men really isn't needed. So prostate cancer for men is tricky. The idea being that if it's an indolent cancer, a lot of people are found at autopsy to have prostate cancer, and it didn't really shorten their life at all. So knowing about it really isn't that important. But I would say for men, talk to your doctor. Your family history is going to be very important when it comes to whether or not screening with a PSA is right for you, or other forms of screening with a digital rectal exam. But that's really a conversation to have with your doctor, because it's not for everybody. If we screened everybody, a lot of men would be getting prostate biopsies who don't need them.
Okay, so Dr. Evans, I know a lot of men have concerns as well with breast cancer. So going back to breast cancer, do men need to have, and all men need to have a mammogram, or which men should have a mammogram? I know they need to do self-breast exams, so I'm sure if they find a lump, that's one thing. But yet we don't always go when we have a lump, we go for our annual. So which men should be having the screenings, and what types of screenings for breast cancer?
Yeah, that's a great question. Because breast cancer is so much less common in men, the guidelines are really not all that clear. But certainly if there's a lump that somebody feels on a self-exam, that should be brought to medical attention. Certain families can have breast cancer gene mutations. The women in the family are very likely to get the breast cancer if they have one of those genes, but men can get breast cancer too. So men who are in families with known breast cancer genes should be checked annually, whether that's with an annual visit with a physician and a breast exam, or with a mammogram. I think is up to debate. It really depends on how much breast tissue an individual has, whether a mammogram would be technically feasible or not. So that's a good group of people to keep in mind. If there's a strong family history of cancer, somebody who's had breast cancer should be tested for those breast cancer genes. And if it's positive in the family, then potentially men in the family could be tested for that as well.
All right. Well, thank you, doctor. When we come back, we will continue our talk about cancer awareness with Dr. Michael Evans from the Lehigh Valley Health Network. Stay right here on SSP TV. You're watching The Girls.
Welcome back to The Girls. Today we're talking about a very important topic of your health, and it's all about cancer and cancer screening, early detection. We're with our guest, Dr. Evans, and he is from the Lehigh Valley Health Network Oncology Department. He is the head of the regional and the local, and you're watching in the Hazleton area. So we have the Lehigh Valley Health Network here in Hazleton. Doctor, we've covered so much ground on some of the cancers, but if you could just touch on maybe some of the cancers that are more hereditary related. In other words, if your mother had, or your aunt had, or there's just, it seems like everyone in the family, maybe the women, have had breast cancer. How do they find out if it's hereditary? Is there a certain marker in your blood? Is it just a chance? Tell us something about the genetics of cancer that you've been finding with all of the research.
Okay, yeah, that's a great question. There are certainly many cancers that are hereditary, and there are cancer families that know this very well. So breast is the most common one. There is a breast cancer gene mutation, or BRCA1 and BRCA2, which increases risk for breast cancer. Ovarian cancer and other cancers can also run in those families. So what we generally recommend is that people with a high suspicion are seen by a genetic counselor. And so that is one route. So we have genetic counselors who can do a visit with people out of their office in Allentown. They can do it remotely, or else they can see the patient in person, and they can run a comprehensive group of tests on the genes to see if they have any cancer-related genes. Short of that, we can also do a lot of that testing from our office. I always think it's best to do it with a genetic counselor, because they're trained in this, and they can follow the family tree and link up all the different types of cancer and really hone in on what genes might be involved. But if people can't make the trip to Allentown, we can get a lot of that testing started in Hazleton.
So someone who, might not be familiar with what Lehigh Valley Health Network does, if we can touch a couple minutes on how you specialize in cancer treatment, and would a patient specifically stay at one branch of the Lehigh Valley Health Network, or how does it work? I think sometimes people and having that unknown, they're scared to even go to the doctors to see if they have something. So again, trying to get as much information out on the process, might make it easier for them to actually go and seek some treatment.
Yeah, that's another great question. When it comes to cancer, there's a lot of different modalities of treatment. So the one that we give in my office is the so-called systemic therapy. So that's chemotherapy. Sometimes it's in the form of a pill. Sometimes it's intravenous, immunotherapy, and things like that. That's what most cancer patients end up getting. So they can receive all of that in Hazleton. Some patients, especially if it's an earlier stage, will need surgery right up front to remove the tumor, and then they'll get chemotherapy after that. So depending on the type of surgery, in Hazleton, we have surgeons who do surgery for breast cancer, for colon cancer, a lot of the more common cancers. When it gets a little bit trickier, when say it's a cancer of the esophagus or the pancreas or certain gland cancers, then we have surgeons who are trained in cancer surgery, and they're down in Allentown. Now it is a trip, but it's usually only to go down, get the surgery, and then come back up to Hazleton to receive the rest of their treatment. On that point, we are building a new cancer center in Hazleton, and it's going to be at the hospital, the Lehigh Valley Hospital Hazleton site. It's going to be a 3-story building with infusion and also with radiation oncology. So that's the third major modality of cancer treatment. Right now, we're partnered with a local radiation group, but once we build that new cancer center, we're going to have Lehigh Valley Cancer Institute radiation available right here in Hazleton as well. And another part of that is an extension to the Greater Lehigh Valley Cancer Institute and the affiliation with the alliance with Memorial Sloan Kettering, which will open up a lot of clinical trials, which will have for people who have gone through most of the common treatments that we give for cancer, and are still looking for something new. That's when the clinical trials would come into play, and that will be available locally as well.
So Dr. Evans, seeing this every day and coming through all of the different forms of treatments and follow-ups with the patients, what is it like for you as a physician, as a doctor, as a person, just to see when someone is either in remission or they've had a cure? What kind of feelings are it for you and your staff? I mean, they just get so close with everybody.
That's really a great question. I'm glad you mentioned the staff too, because not just the doctors, but we all chose to go into cancer medicine for these reasons, to help people with cancer and ideally to cure them of their cancer. I remember years ago when they first cloned the sheep in England. There's so much news about how we would see in our lifetime that we would start curing more and more cancer, and that's what got me excited about going into it. And I think we're seeing that it's playing out. We're better understanding cancer. We're designing better treatments. We're picking our patients better, and it's really just a great feeling to see that we're making so much progress.
Okay, Doc, so what are some of the signs that an early cancer that you might have it so you could go for a screening or just to your doctor?
So any lumps or bumps, or if it's a gastrointestinal problem with bleeding, I think those would be concerning symptoms. Very
good. And I'm sure there's a lot of information on the website. If people do have a concern, please call your doctor immediately. I hear so many stories of people who they're scared to call the doctor because they think something's wrong. Like, that's when you need to call the doctor, right? So again, Doc, thanks for joining us on the program. If anyone needs any information through Lehigh Valley Health Network, I know you guys have a great website. And if you're not from the local area, please check with your physician. Again, you are watching The Girls here on SSP TV. It's Breast Cancer Awareness Month in the month of October, but The Girls are focusing on cancer awareness for all of our shows in the month of October. And we wanted to thank the Lehigh Valley Health Network again for what they do in our community and support for SSP TV and our local programming. Doc, thanks for joining us here.
My pleasure. Thank you very much.
Thanks again. You're watching The Girls. We'll see you next time.